this is the reason for, and the remarks for giving the discount is mandatory. The problem is that the remarks column is text column, so you have to write down things, right? I would I would have suggested that they should have a drop down list. Why? So they can run a report to identify that okay, you've given so many discounts, and the discounts major reason has been for this reason. It makes sense. Then you have an analytics. If you write things like that, someone is going to do this dot and then say click on OK. What you're going to do? There's nothing you can do to avoid that. So there is a possibility of that happening also. There is a report that we can tell you that who has given discount, how much, and what all these things. And there's a privileges also to control this percentage of discount that you can give. Like for example, maximum Sama can give is 20% discount. You have that control. My only problem with this screen is that when you say authorized by, when this thing comes in, if I click on Saad's name, this thing comes up as password. That means Saad has to come to my desk, enter the password, or take any desk or team viewer of my screen and put the password and then proceed. It's good that you see these things in Danube and in Panda and all, but in the real time, in the clinics, hospital, you can't ask people to run around, supervisors to run around and do these things. Unless they are okay with this, then it's okay. Then that's fine. And if they're giving privileges to more people, then that's something that you can do. Operationally, you guys can decide how you want to take forward for it, but this is what you have in the system. Anyways, I'm going back. I'm taking the insurance that I have wanted to. I'm going to collect 34 riyals from this patient. Click on save. It says that Dr. Abdul Rahman doesn't have a schedule. Do you still want to proceed? Maybe it's a walk-in because it checks that he doesn't have an appointment schedule, but still you're taking an appointment with him. What's it? What's this? But this is a walk-in like a thing, special consultation. So I'm gonna say yeah, I want to proceed. I'm gonna do walk-in. This is the screen for cash collection for the people. You will be collecting 34 riyals cash. We can have that as cash collection, or you can keep it as card. That means I'll have to select the provider and do all those things over here. There is supposed to be a POS integration with the machine itself. That means if I put 34 riyals over here and if I put 34 riyals and scan it, then automatically it should pass the information over here. But sadly, I don't think so that has been concluded as of yet. You also have an option of bank payment, which no one does, and advance payment. So if this patient, let's say, had some amount due on him, store credit sort of scenario, if he had done some service, but then he cancelled it, so that amount we did not refund him in cash, but we told him that this amount has been kept on your account, so he can use that advance amount to use for his other consultation or other services in the hospital. That's something that you can do. Anyways, so I'm collecting as cash. You can do part collection also. So for example, I can do 450, or I'll say 1450. I'll take as cash, and in card, I'll go and say that I will collect the rest of the 20 years. There's no harm in the screen. I mean, there's a lot of information there. You see, these are all human interventions. No one does this. That's the problem of this particular screen. Now it says that everything is there. There's a total of 14 riyals cash, and card has 20 riyals, and then accordingly it will be saved. The good part about this screen, account management is very well. You will get exactly how much money someone has collected, and at the end of the day, you will get split by cash, by card, and all those things. That's very good. Difficulty is doing all this hassle. If people are doing this, it's great. But I don't think most of the people are doing it. They are all collecting as cash and then just keeping the span of the scan cards. If you go to any reception right now and check this thing, and I will show you how to check it, you will find that most of the people are not entering the card details. They're just collecting the money as cash in system, but in reality, most of the people are doing card swipes. So that is one error that we need to highlight also. I click on OK, and it will now generate in a receipt for that, and then you can print out the receipt and things like that. Also, it gives you an encounter number. Then starts an episode for you, creates a token number for you, and an invoice number. These are all the information that you can see. I am right now token number 1W. That means I'm the first walk-in patient. I could have been, if it was 1A, I'm the first appointment patient. That's how they are playing around with it. Do you want to print the invoice, yes or no? If I click on yes, then it will be yes. I'm going to try to say yes to see what happens. I think the printout has gone to there. Okay, thank God it didn't work. Yeah. So that's there. Notice what is happening over here. This thing has started blinking now, right? Why does it do that? Because it gives an intimation to the reception. If I came for the first time, I opened Usama's file, I will be able to see that this patient has an active episode. He's already seeing Dr. Abdul Rahman. There is a treatment ongoing. 14 days is ongoing. So that means I can click on this and I can see, okay, he came for his episode number one was with internal medicine, Abdul Rahman, started on 11th of Jan, and apparently is going to be finished on 24th of Jan. There is one free visit still available, and the status of this episode is open. You hear me? That's something you can do. So now if I do that, if I click on this and if I say after 3 days I came back again for follow-up, example, what's gonna happen? I'll look for myself and if I double click on Abdul Rahman, see all the information is automatically entered. It shows me the first encounter that I did, and this is going to be my second one. Consultation is a follow-up, automatically selected. I didn't do it, and the charge is zero. That's the good part of it, that it automatically then concludes that there's a free follow-up and then you can utilize it. That's the good part of that whole thing. Uh, Service delivery, straightforward. Once the patient goes to the doctor, the doctor's going to place some orders and all, and then there's going to be approvals, and that's how we are going to get do the billing. This is the place where you will come and do the billing for the services, and you can see what are the services under that thing, and you can sort of bill all this information. I would have loved to see someone who already has a bill, but let me see. But before that, let me show you the other screens that are there. Taking an appointment, for example. If I want to do that same thing again, if I want to take an appointment with internal medicine, I'm going to search over here internal medicine. God. So you can take an appointment if you want to. Okay, by the way, there's an option available where you can sort of go into search for the department, and then there are different doctors that will show you that are under there. Click on any of the doctor and it will show you the schedule. This person has no schedule. So does this person. The best way to do is that you click on this tick mark, black tick mark, that takes you to the next slot available for that doctor. So, for example, if I click on this, it will take me to the next available slot of the doctor if it's available. If there's no, then again, can't help it. Same thing here. There's no this thing. So, no available slot. Great. But that's how you can take an appointment. I don't know of anyone who has an appointment right now. Let me just try cardiology. I just want to show you an example of that. That's it. If you guys know this already, then I'll not bother you. Okay, great. So there you go. This Dr. Ahmed Rashid, I want to take an appointment for Osama. How do I take it? Select his name from here, drag it over here. Which appointment do you want? 5:15, 5:30, 5:45? Just drop him over here. Either that or drag him from here, drop him here. You can do that also. Or you can just simply click, if you're already on the patient's file, then simply click on the green tick mark to fix the appointment in order to do that. The green dot that you see next to it, if you see this screen is not visible and it's getting difficult for you to sort of view, just click on the gray lines and then they will close so you have a wider experience. If you want to see the other slots also, like between 6 o'clock, if there are any appointments booked and you want to see those who are the patients under that, you can always uncheck the free slots button so it will start showing you all the slots that are filled up also in this thing. Here you have different color coding also that appointment team can do in order to highlight that these slots are for inpatient, this for outpatient, these are for I don't know, follow-up patients, for VIP patients, blah blah blah. You can there are different scenarios and yes, you can do all those things. This green dot, this green dot over here is for the sake of if you want to block for a certain period of time. Like for example, if I click on this for 1 minute at least, uh, other people will other people will see that this appointment is blocked. So that is something that you can do. Excuse me. Okay, sorry. Yeah, so you can always do that to see the appointments, to block an appointment for a while, and you can book an appointment. I'm going to try to do that. 5:30 appointment. There you go. It sees that Osama doesn't have Osama has never seen this doctor in the before, so it's not a follow-up appointment. It's a new appointment. So yes, it does that, a new appointment, and will allow me to see. There's also an option for slots. I can switch 2 slots, 3 slots. I can book multiple appointments if I have to, and I can do that. So that's also there. I click on OK, and my appointment is booked. Notice that Osama now has an appointment over here. What happens with this is he gets an SMS and things like that, right? Notifications and all goes up, of course. So appointment has been booked for the person. If I go to the patient information screen, if I go to patient information, see, now you will see that on 12th of Jan, Osama has an appointment with cardiology. On the day of 12th of Jan, this green tick mark that you see over here, this will change. It will become green. And if I click on that, it will take me to the encounter screen to show me that show me the billing information for that appointment. So converting an appointment into a billing of an appointment is very easy. It's like one step, one click sort of thing. That's very nice, very easy also. Now that we've done this, the other part I will not go into it. I want to first high level take you through the pre-authorization section also. So let's go through that first today. Then we will come back and we will see the other part. I'm going to do pre-authorization part first, just to explain you the pre-authorization screen, and then we will come back to the service billing that authorized. Once we got an approval, then how did we bill it? We'll see that scenario. Anyways, I'm coming here for my insurance approval screen. It's on the left-hand side, like I showed you. I'll show you once more. Beware, the screen is very slow. It takes time to load sometimes, so it's very annoying. But it's one of the important screens, of course. So how did I get here? Under my patient management suite, under FO, I have something called insurance approval. Okay. There's a shortcut for it. Click on Control I. It will take you to the insurance approval thing. If you click on Control N, it takes you to the registration screen. This is a shortcut that you guys will realize if you're using most of your session. Okay, so the approval screen. What do you understand by this? On the top part is the filter. You can search from a date period from where you went to when. That from you're taking this approval request was done from this period to this period. Then you can of course search that. You can also filter by insurance companies. Let's say I only work exclusively for Bupa, or I only work for Ministry of Health. I don't know, something like that. So yeah, you can do that. You can filter. I work exclusively for ANOVA. I mean that would be like very rare, but yes, that is also there. You can filter by that also. Visit type, OP IP. So if you have two different teams, one team working very fast for OP and one team working preemptively for IP, you can do that also. Service type, within IP, people split teams. They get approval teams for pharmacy separate and surgery different separate. That is also something that people are doing. And if you wish to do that same setup over there, yes, we can. Status is something that are different statuses for the requests that come in. I will explain you each and every request that is there and how it works. By default, a request starts with open this thing. That means when does the request start? First of all, let's understand that. And when a doctor clicks on, when the doctor adds the services in his screen and clicks on save, once he does that, it will go to two places. It will go to the billing desk and it will go to the approval screen. Some things that are already included in the contract, like CBC and like basic things, are of course going to go directly to the billing desk, and the billing people can bill it. But the things that are need approval, they can't bill it. It will be hidden. It will be grayed out, so they can't bill it, and it will say that it needs approval and it's still waiting for approval. This then starts from here. Here there will be a request that will be created under one line, and that line will be open. You can he can then post it. By post, he means that he has acknowledged it. I have posted it to Osama that he will take care of it. Okay, I've assigned it. You can say post is something nothing but assigned. Someone is working on it. Third thing is send. Once I send it to the insurance office, so I'll go to the Bupa website, or I will whatever it is, or I will say that everything is fine and